The family is number one.
And we're your number one family radio.
Inspiration.
105.9. Shivers, fever, severe fatigue, headaches or vomiting are some of the signs of malaria. As soon as any of these signs appear, do not take any risks and consult a healthcare worker. Be aware, malaria can be fatal if not treated in time. A health worker, nurse or doctor will perform a diagnostic test to check for the presence of the disease. In case of malaria, they will be able to treat it. Following their advice is essential to be completely cured.
Inspiration FM is inspiration.
When managed in time and with the appropriate medicine, malaria can be treated. After diagnosis, the health worker, nurse, midwife or doctor can provide the medicines or a prescription to pick them up at the pharmacy. Do not buy medicines at the market or on the street. They are dangerous. Be careful, even in case of rapid recovery. Stopping the treatment before the end does not allow a complete cure.
Inspiration FM.
A very warm welcome to Health Break. Obviously, just listening to that, I'm sure you can relate to what we are speaking about today, to educate you, sensitize you more. So we are talking malaria, and the focus is on dangers of clinical diagnosis in malaria treatment. Dangers of clinical diagnosis in malaria treatment. I have in the studio this morning from the State Malaria Elimination Program, the Case Management and Malaria Vector Research Officer, Mrs. Mfon Jonah, is live in our studio this morning. Good morning, and thank you so much for joining us.
Good morning, presenter, and good morning, Akwa Ibomites.
So I started off by actually getting people's minds prepared with that. I just didn't want to listen to that alone. So that message is from SANOFI. Okay, SANOFI actually put this message in the social media space, and I decided to bring it on here so every other person can listen to it. So SANOFI is an innovative global healthcare company. I don't know, somewhere in France, that's where the company is. And, getting to hear that message just gets to tell us that malaria is treatable, it's curable, and it's possible for us to do the needful in terms of when we are down with malaria, we can actually take treatment and get better. So the focus is on the dangers of clinical diagnosis. I just want to give us a tip. So eventually I'll hand over to Mrs. Mfon Jonah to break it down for us. Clinical diagnosis is the estimated identification of the disease underlying a patient's complaints than on laboratory examination. So that still sounds like it's a bit complicated. Yes. But simply put, when you talk about clinical diagnosis, like what you heard, started with talking about fever, chills, some of the symptoms. So when we talk about clinical diagnosis, it's just simply what? Break it down for us.
Thank you very much. When we talk about clinical diagnosis, it's simply depending on just an assumption. Maybe when one is having fever, headache, and maybe pains, without going thoroughly to investigate to actually know whether the fever, the pains, and all the aches is from malaria. So once someone is having fever, aches and pains, it's not only malaria that has fever. Fever is just an indicator to tell the individual that a foreign body has entered into the system of that being. And so we need to avoid clinical diagnosis by carrying out thorough investigation, by testing before we treat. And that is what the current revised 4th edition guidelines of the malaria protocol. That is that about clinical diagnosis.
Okay, so that's the emphasis on. It's very important that in spite of the symptoms one is feeling. Yeah. So you have headache, you have chills, you have fever, and then you want to possibly just think that, that's malaria.
No.
So that's what clinical diagnosis means,
yes,
based on the symptoms.
Based on the symptoms and assumption by even the healthcare provider, without dealing deep deep into investigating or carrying out a test to be sure that it is malaria. And the test can be done using either the rapid diagnostic test kit or the microscopy, which is the gold standard. So we just need to be sure that this person is having the fever, the aches and pains is as a result of malaria.
Okay, before we go to talking about the hazards of actually treating malaria based on just looking at the symptoms and, guessing or just saying, okay, based on the symptoms, I think it's malaria. Let me just take us through this as well. Because sometimes when you say malaria, some people think it's not a very serious illness, because it's possible to take, medication and get well. But then, according to the World Health Organization, malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquitoes.
Yes.
So let's talk about how life-threatening malaria is.
It's life-threatening because it kills a lot in this part of the world, and is the common disease that affects our people most. And the reason why we say it's life-threatening is actually because of the way that this the malaria itself, the parasites, the vector, the parasites are dwelling with us and always around this side, and it's endemic in this part of the country. And as such, when we talk about being threatening, it takes a lot of people's life. So we need to be very careful about malaria because it kills more than any other disease.
It does kill, but we don't get to see it that way because it's curable.
Yes, it's curable, it's preventable, and it can lead to death if it is not properly diagnosed at the start when the clients come at first presentation to the healthcare provider. We need to look at it deeply and then carry out some tests, probe from the patient to know how it is, and then carry out the test either by rapid diagnostic test kit, which will give you the result within 15 to 20 minutes, depending on the manufacturer's prescription, or you carry out a microscopy. So when we don't do that, then the condition can deteriorate and may go down to developing what we know as severe malaria. And to even start with malaria, when we talk about malaria currently, according to the new protocol from WHO, it is looked at or is treated in two perspectives. We look at it as uncomplicated and severe. When it is uncomplicated, simply then means that this person has malaria and all the signs and symptoms of malaria are there, and but does not have any involvement with a major organ in the system of that individual. And that person is able to, take oral medication and is able to take care of his or herself. That kind of individual can be treated at the OPD level. He just comes.
That's outpatient.
Yes, outpatient. So they will just come. We take those sample, and then if it is malaria, we just treat them with the prescribed medication, which is the ACTs, artemisinin-based combination therapy. And in that artemisinin-based combination therapy, we have in two forms. We have the AL and the AA. So we make do with the AA, which is the first line of treatment for uncomplicated malaria.
Okay. All right, I'm speaking with Mrs. Mfon Jonah. She's from the State Malaria Elimination Program, and we are talking about the dangers of clinical diagnosis in malaria treatment. She is the Case Management and Malaria Vector Research Officer with the State Malaria Elimination Program. You can be part of the program this morning. 0906 030 8705. 0906 030 8705 is the WhatsApp number to send your messages to this morning to be part of the program. And also, you can call in to be part of the program. We are talking how we can actually avoid, getting hit to a point where it leads to death. You're down with malaria, doing the right things and getting better is very important, because you just treating indiscriminately can cause lots of problems. Malaria, you might think, is no longer a big deal, but it's actually killing. So I look at the statistics. I don't know, this is 2020. Possibly you can also help with latest statistics. In 2020, there were an estimated 241 million cases of malaria worldwide. Estimated deaths stood at 627,000. That's in 2020.
Yes.
I don't know about now, but 627,000 worldwide for persons that have actually died as a result of malaria complication.
Yes.
That's a lot. So is there a latest statistics for maybe 2021, 2022 in terms of a death?
Yes, that is exactly what we have in the data based, and this is so because it affects more of the under 5 and the pregnant mothers. So malaria is very is a killer disease that dwells with us because they are endemic in this part of the country. And this one of the dangers of not going through the routine or the guidelines in the malaria treatment.
Okay, so I was going to come to that, but then just remind the callers that you can be part of the program this morning. Send your messages to the WhatsApp number again at 0906-030-8705, 0818-222-9105 is the number to call with to be part of the program, 0905-995-1059, and the numbers to call in with to be part of Health Break this Tuesday morning. Okay, so let's just go straight into what the dangers are. So I feel headache, I feel I have fever, or possibly the last time I treated malaria and I got better, there were certain ways I felt. So it comes back and clinically,
okay,
I'm saying I have malaria and I begin to treat with, the same medication or looking for, what are the dangers?
Okay, one of the dangers of not using the prescribed guidelines in the treatment of malaria is, one, that individual may go down to developing anemia because there is activities of the parasite working in the red blood cells. There is excessive destruction of the red blood cells caused by the parasite in that individual. Then the other one, we can also have some form of seizures when the malaria had been there and this person is not giving the actual treatment because they did not know. They just go about just taking the drugs because they can take the drugs, but the thing is killing. The parasite is working, and the fever, when it's high, the tendency to affect the nervous system, leading to seizures. And then the other one is that we may also have some form of coma resulting as a result of
someone
malaria.
Can slip into coma.
Yes, you can go down to developing coma, and even death can occur. These are some of the dangers that treating malaria without testing or going through with the prescribed malarial guidelines. So we need to make sure we don't go down to developing all this kind of problems. Because
so these are the threats that actually can be manifested
to life. Yes.
This is you talking about possibly individuals,
yes.
Just feeling in a particular way and walk into a chemist or to actually get drugs to treat.
Okay.
But then we also have that situation where even in the hospitals, clinical diagnosis is being practiced.
Okay.
Do you agree?
Yes, in some hospitals, but not now. Why I'm saying it is not now is because we, the SMEP, SMOH department have worked, the State Malaria Elimination Program Unit.
The State Ministry of Health.
We have worked in assistance with that is in collaboration with the partners that are in the state. We have done a lot of work concerning that and trying to pull out our healthcare providers from what they normally would do, like the holding on to the clinical diagnosis. So now all the facilities are aware. So, but that was before, but not now again. So now everyone is aware of the fact that malaria should be tested and then treated accordingly with the prescribed anti-malarial drugs. So the clinical diagnosis is a foregone issue as far as Akwa Ibom State, healthcare settings is concerned.
Okay, because I know that the World Health Organization had in their guidelines lately insisted that tests must be carried out on patients before malaria treatment is administered or given.
Yes.
Very emphatic about that,
Yes.
because that way it will help to reduce things like drug resistance.
Okay. That is that. So when we have these people who come to the facilities, we need to also make sure that we prevent these patients from developing drug resistance.
Okay,
because if
we'll get to that again. I have a caller. Good morning to you.
Good morning, Ima Dem. Good morning, the guests on the studio.
Good morning.
Good to have you join us. Thank you so much for joining us. Go ahead.
Please, I want to ask, because it seems so many illnesses or diseases have been tamed, controlled. Why is it not possible that malaria is tamed or controlled? Is it not possible that in children, babies, for instance, at the health centers, they should be inoculated that this malaria should not come up when they grow up? Is it not possible like that? Or another thing, is it only mosquitoes that cause malaria? What about sandflies, these small flies that bite you and you have the effect? Is it not possible?
Okay, thank you very much. I want to quickly answer to your question that says if we cannot control it. We are trying to do the control measures, which you, as you are speaking now, you are one of us that you can also control malaria right from your own dwelling, by making sure that your child sleeps inside the treated bed nets. And talking about the inoculation, that is being worked on. But currently,
that's talking about vaccine.
Yes, we are not having that done here in Nigeria. But some time ago, I think I saw there was a pre-testing. It was carried out in Kenya and Ghana to the under 5.
So we are getting close to that point.
So we are getting close to that point, but not yet in Nigeria. So you can also prevent your under 5 from developing malaria by making sure that that child sleeps inside a treated mosquito net in the night. And the only thing that causes malaria is nothing else than the infected female Anopheles mosquito, that once it bites someone that has malaria, it picks up something and then lands on another person that didn't have malaria. In that form, it will transfer the disease to the next individual. So we need to prevent ourselves from being bitten by the female Anopheles mosquito that works mostly at night. And the biting of this mosquito can only occur from 6 p.m. till 4 a.m. in the morning. And that is when they do their work. They use your own blood to make their procreation, to continue to procreate and fill the whole environment. So all that we need to do is to make sure that we keep our environment clean, sort our refuges well, and then dispose them properly. Those ones that can be burnt should be burnt, and those ones that you cannot burn, you can take them to the appropriate. That's how much you can, how far you can reduce the breeding ground for mosquitoes, so that once they are breeding around you, they are bound to come into your houses and then you'll be bitten by them.
Okay, I'm still speaking with Mrs. Mfon Jonah. She's from the State Malaria Elimination Program, and she is talking about the dangers of clinical diagnosis in malaria treatment. Very, very important that you get tested to be sure that it's malaria as you treat, as you use those medications. Very important. That's the emphasis this morning. I'd like to ask about what the State Malaria Elimination Program is really doing. Like you said, clinical diagnosis in our hospitals is a foregone issue. But I'll take a very short break.
Inspiration FM.
Mama Put!
Hey, the last time you were here, you weren't feeling well.
I went for the blood test at the health center and found out it was malaria.
But you look much better now.
I felt better when I started the drugs. In fact, I didn't need to finish taking it.
Don't you know that if you don't complete the treatment, it's useless?
But I'm saving the medicine for next time. Please give me my draw soup and fufu. Mama Put, why are you serving me half plate?
Since you are practicing saving techniques, let me help you save the rest of your food for later in case you get hungry again.
How? I will definitely get hungrier and I'll not be able to focus on my work.
See, not completing malaria treatment is like taking half portion of food when hungry. Your malaria can come back more serious and the drugs you have saved won't be enough to treat it then.
Sense, Mama. I received sense, I go do am correct now. I promise to complete my remaining medicine.
Receive sense, so do am correct.
Fever can turn serious if you don't seek care quickly, especially for children under 5. Test first and complete the treatment accordingly. This message is brought to you by the Federal Ministry of Health and the American people.
So good to know you're still there listening to Health Break. Thank you so much for staying right there. Keep your calls coming through. Messages that you can also send to ask questions. Mrs. Mfon Jonah is still here. 0818-222-9105. 0818-222-9105. 0905-995-1059. And the numbers to call in with to be part of Health Break this morning. So I'll just go straight back to my guest. And I was talking about what the State Malaria Elimination Program is really doing to reduce the situation of clinical diagnosis, knowing that this is not the way to go if we are to make progress. Let me take this call and hear what this caller has to say. Good morning to you. Welcome to the program. Good morning. We can hear you loud and clear. Go ahead. What's your name? Where are you calling from? And let's have your question. Hello, can you still hear me? Hello? I'm wondering what's happening to your line. We cannot hear you. Hello? Okay, apologies, I have to let you go so we can actually keep up with the time. We still have much more to look at. Okay, so that's it, because I just want to take you through, in 2020, a particular report I did on clinical diagnosis. I was able to access the database through the DHIS, and it wasn't looking very good. That was in 2020. So we had as much as 1,106 patients clinically diagnosed. About 1,110 patients were given ACT treatment. We had those issues. So now you're saying it's a foregone issue. Can you talk more about how foregone that issue, or how the program, the project in Akwa Ibom, when it comes to malaria control, is tackling this problem?
Yes, I can say that it's a foregone issue because currently the State Malaria Elimination Program units, we are not relenting. We have been working. There is no time you come to the office that you'll find any of the officers there. Why? Because they are in one program or the other. Like currently, we have just concluded, from my own area, I've just concluded the mentoring to about 10 facilities in which I was successful in 9 of the 10 secondary health facilities in the states. I did this with the help of the trained clinicians on malaria case management. Okay. And so we move into the facilities trying to teach those people that are there at the work space so that they know how to reconstitute IV artesunate and how to administer those drugs to the clients and what kind of client should receive such drugs. So another one is the malaria people are not also relenting because the diagnostic area EQA is being carried out, the external quality assurance. We want to see how well assured is our MRT kit and our microscopy. So we are working, and we know that with all these things put together, the healthcare providers will not for any reason go back to what they used to have as having to hold on to clinical diagnosis. I have a caller.
Good morning to you. What's your name, please?
Ima, good morning.
Good morning. Thank you so much for joining us. Okay.
Please, your guest has talked about prevention of malaria. One of them is through sleeping inside treated mosquito net. Let me ask, is it in the market, you buy in the market, or is it the government that distributes? And if they distribute, how often do you distribute this mosquito net so that it gets to the people?
Okay, she'll respond to that.
Okay, for the treated bed net is given to us by the government, and the very last time we distributed, we did a mass campaign on that was in 2018, and we're already due again to have that. We do this every 4 years, and we are almost ready to get this done in the state. As I'm speaking to you, the state is getting ready because everything had been done, and we are very sure that before the year is
okay,
out,
so residents should be expecting
yes,
the distribution of the insecticidal nets.
Yes.
All right, then, we don't have much time, so I'd just like to ask, straight to the point, one begins to feel funny. Headache, chills, other symptoms, what do you expect the person to do?
Okay, once somebody has a headache, pains, chills, and all that, all you need to do is take yourself to the nearest health facility approved by government and then carry out some tests. And the tests that we need to do, the first one is the rapid diagnostic test, which we use at the primary healthcare levels, and the microscopy test, just to be sure that what you are having is not or is malaria, or if the test result is out and they are telling you that the test is negative, you just have to accept it that way, that it is negative, and then maybe you further go on to asking them to test you for other things, or the healthcare provider may even suggest that you go in for other tests so you can be sure of what is actually the problem, because COVID-19 also have all the signs and symptoms of malaria.
Or other ailments could actually manifest that way.
So you need to be sure it is malaria before you start taking any drug.
And just like you emphasized, some persons get to, undergo clinical diagnosis.
Yes.
They get treated, and you talked about some of the side effects. So can you highlight them again?
So the side effects are, if you are not sure you are having malaria and you are being treated clinically, you are likely going to have what we know as recrudescence, because continuous taking of the drug, but you don't know whether the drug is working or not. You may have that because that will be when the parasites are not cleared from the system, despite the fact that you had taken the drugs, and because you did not take the correct drug at the correct time. Another one is that there might be anemia resulting from
low blood.
As a result of the depletion of the red blood cells by the parasites. You can also go down to having coma. You can go down to having seizures and even mental confusion.
Lots of problems.
Yeah,
really.
lots of problems.
Okay, so the next time you come, I'm sure we'll be talking about how much, the enforcement of these guidelines in terms of treating, pushing away clinical diagnosis, ensuring that people get to do their tests before they get treated, is actually reducing the burden of malaria in Akwa Ibom.
It's actually being enforced for now.
Bringing the statistics.
Coming about.
Exactly, we look forward to that. So we look into that database, and I want to see a drop in the statistics I just talked about. 2020, this is what I found out.
Okay.
Thank you so much, Mrs. Mfon Jonah, for coming on the program. And that's it on the program. Mrs. Mfon Jonah is the Case Management and Malaria Vector Research Officer at the State Malaria Elimination Program. It was a pleasure having you.
Thank you.
On the program. My name is Ima Dem. Do stay with us right here.
Female mosquitoes are responsible for malaria. They lay their eggs in stagnant water, even if it is clean and in small quantities. Puddles, containers, hollow objects, and wells are places where mosquitoes lay eggs. It is therefore essential to remove puddles of water, to cover all hollow objects that may contain water, such as containers or wells, to avoid the multiplication of mosquitoes. Also, be careful to cut long grass where mosquitoes live.
Motherland of the world, Africa. We love you. Inspiration FM.